Welcome. Today we're diving into a condition called acoustic neuroma, also known as vestibular schwannoma. While the name might sound complex, understanding the basics can be empowering. We'll explore what it is, what causes it, how it affects your body, and what can be done about it. So, what causes an acoustic neuroma? In most cases, it's a spontaneous event with no clear, identifiable cause. It's not typically inherited. However, there's a rare genetic condition called neurofibromatosis type 2, or NF2, that significantly increases the risk of developing these tumors, often on both sides of the head. Now, let's look at the how. Acoustic neuromas are benign, meaning non-cancerous, tumors that arise from the Schwann cells of the vestibulocochlear nerve, also known as the eighth cranial nerve. This nerve is crucial for hearing and balance. As the tumor grows, it puts pressure on this nerve, as well as adjacent structures like the brainstem and other cranial nerves. This pressure disrupts nerve function, leading to the various symptoms we'll discuss. Acoustic neuromas are relatively rare. They're estimated to occur in about 1 to 2 people per 100,000 each year. The average age of diagnosis is between 50 and 60 years old, although they can occur at any age. While both men and women are affected, some studies suggest a slightly higher incidence in women. The signs and symptoms of acoustic neuroma can be subtle and develop gradually. The most common early symptom is hearing loss in one ear, often accompanied by tinnitus or ringing in the ear. Other symptoms can include dizziness, vertigo, balance problems, facial numbness, or tingling, and, in rare cases, headaches, vision changes, or difficulty swallowing if the tumor becomes large enough to compress the brainstem. Diagnosing an acoustic neuroma typically involves a combination of hearing tests and imaging scans. An audiogram, or hearing test, can detect hearing loss and assess the function of the auditory nerve. MRI, or magnetic resonance imaging, with gadolinium contrast is the gold standard for confirming the diagnosis and determining the size and location of the tumor. In some cases, a CT scan may be used. While not strictly types, acoustic neuromas are often classified based on their size. Small tumors are generally less than 1.5 centimeters, medium tumors are between 1.5 and 2.5 centimeters, large tumors are between 2.5 and 4 centimeters, and very large tumors are greater than 4 centimeters. The size of the tumor often influences the treatment approach. Treatment options for acoustic neuroma vary depending on the tumor's size, growth rate, and the patient's overall health and preferences. The main approaches include observation, stereotactic radiosurgery, and microsurgical resection. Observation involves regular monitoring with MRI scans to track the tumor's growth. Stereotactic radiosurgery, such as gamma knife or cyber knife, delivers a focused dose of radiation to the tumor, slowing or stopping its growth. Microsurgical resection involves surgically removing the tumor. Each approach has its own risks and benefits, and the best option is determined in consultation with a multidisciplinary team of specialists. Unfortunately, there's no known way to prevent acoustic neuromas, particularly those that arise sporadically. For individuals with neurofibromatosis type 2, genetic counseling and regular screenings are crucial for early detection and management. The prognosis for acoustic neuroma is generally good, especially with early diagnosis and appropriate treatment. While some hearing loss may be permanent, the primary goal of treatment is to control the tumor's growth, preserve neurological function, and minimize symptoms. Research continues to focus on improving treatment techniques, minimizing side effects, and developing new therapies for individuals with NF2. Some studies are exploring the potential of targeted drug therapies to slow or stop tumor growth in NF2 patients. Additionally, advancements in surgical techniques and radiation therapy are constantly refining treatment outcomes. Ultimately, if you suspect you might have symptoms, it's crucial to seek medical advice. Early diagnosis is key to managing this condition effectively.